evening, everyone. Welcome to RSSDI Diabetes Bytes. It's the 50th year of this glorious association, and we have just celebrated the Golden Jubilee with a great tribute and fond remembrances of all our stalwarts who laid the foundation of this wonderful association and over the years have worked to make it what it is today. वैसे देखा जाए तो इन 50 वर्षों में बहुत कुछ बदल गया है। बीमारियां और उनके प्रबंधन में बहुत बदलाव आया है और उनके दृष्टिकोण में भी। पिछली दो श्रृंखलाओं में हमने देखा कि डायबिटीज की दवाइयों में कितना बदलाव आया है और क्या-क्या आज सुविधाएं हैं। हमने ये भी देखा कि ग्लूकोज की मात्रा नापने के लिए क्या-क्या अभी तकनीकियां हैं और क्या-क्या मशीन्स और डिवाइसेस आ गई हैं, ये सब भी देखा। और आज हम डायबिटीज के और एक पहलू के बारे में बातचीत करने जा रहे हैं, जो कि मोटापे से संबंधित है। मोटापा भी बहुत ही प्रचंड एक बीमारी हो गई है, जो हम देखते भी नहीं है। हम उसके खाली दिखाव से हम प्रभावित होते हैं, पर हम उसको बीमारी के तरीके से नहीं देखते हैं। So to talk about this very niche subject today and very common, we have four astute clinicians. We have four new niche experts. We have also our RSSDI Obesity Task Force members, and we have our RSSDI Obesity Guidelines and Consensus Development Group today with us. So may I welcome Professor Dr. Soumitra Ghosh from Kolkata. He is Professor and Head of Medicine as well as Department of Obesity from Kolkata. We have Dr. Neeta Deshpande, who is from Belgaum. She is a very senior physician and a bariatric physician too, an obesity expert and Head of Department of Medicine from Belgaum. We have Dr. Rucha Mehta, who is a consultant endocrinologist and obesity specialist from Ahmedabad. And we have Dr. Nitin Kapoor with us, who is an endocrinologist, obesity expert, researcher, as well as an ESI or Endocrine Society of India EC member as well. So welcome to the RSSDI Diabetes Bytes, and let me hand it over to you to talk about the evolution of obesity and overweight in the last few decades in our country.
See, RSSDI is one of the oldest organizations for the care, study and research in the field of diabetes in the world. It was envisioned and formed in 1972, when the visionaries can see that number of the diabetics in the world and in India will increase manifold. In 1972, when this organization was found 50 years back, this number of the diabetics in India was only 2%. Now it has increased to almost 12% of our total population in India. And what are the factors in the last few decades has contributed to this huge increase in the number of the diabetics? And in every family, we can find one diabetic person or somehow almost close to that. And in that study, it is seen that the obesity or increased body weight is the major contributor to this change in the number of the diabetics in India or the prevalence of diabetics in India and across the globe. And it is seen that almost 36% of these, health loss sort of thing, or these disability adjusted, these life years, or these kind of things can be attributed to increased body weight, overweight or obesity, to the development of this diabetes in this country, not only in this country, across the globe. So now, if we just come to this question, that what is the change in this prevalence of these non-communicable diseases? Initially, 50 years back, when this organization was set, these communicable diseases were the major problem in our country, where the malnourishment, these other kind of infection were very prevalent. Now, non-communicable diseases has become a big burden in our country as well. So, this prevalence of non-communicable diseases like this diabetes mellitus, this obesity, this fatty liver, this kind of say dyslipidemia, ischemic heart disease, polycystic ovarian disease are increasing very fast, and this chronic kidney disease as well in the last few decades. So, if we come to the question that what is the increase in the incidence of obesity in the last 4 5 decades across the globe as well as in our country, then we can see that the number of these obese persons or overweight persons whose standard body weight is actually more than what is desired had increased manyfold. It is 3 times over this data of 1975 or so, and in some cases it is almost 4 times than it was found in 1975. In 2016 data, almost 1900 million people across the globe are either overweight or obese, of which 650 million people are actually obese. And if we come to the percentage, those who are above 18 years of age, this is almost 39% of the global population are either increased body weight plus overweight or obese, and of which 13% of the global population is actually obese. And if we come to the children, 39 million children less than 5 years are actually overweight or obese, according to the data in 2020. And 340 million children or adolescents in the age group of 5 to 19 years. And that is also very significant. According to this 2016 data, 340 million adolescents and children are now actually obese or overweight. And this prevalence of this 5 to 19 years group has increased almost 4 times. And it was 4% in 1975, and in these last almost close to 4 decades or 5 decades, it is close to 18% in 2016. And it is not only in the girls and the boys, it is equivalent almost in both the groups, and 18% of the girls and the 19% of the boys in that group are either overweight or obese. And it is a special concern in India when the body mass or this muscle mass in our country is less than the global average. And in India, these overweight and obesity has increased in, I mean, par with this global situation. In 1990, when 9% was actually, this overweight or obese, it has been 20.4% in 2016. And what is more a concern is that for every 100 overweight or obese person of more than 20 years of age in India, 38 adults are having diabetes, while in the global situation only 19 of them are having diabetes when this body weight is more than desired. So what we can see that in our country, when this body weight increases, the chances of diabetes increases almost double compared to the global average. So this is the situation. So so considering all these factors, all these diabetes association has taken the decision for every diabetes management in the chamber visit or so on the hospital setup, body weight management should be an integral part of this diabetes management. So I will come to almost all these consultants, so how it can be done better. So I will come to Dr. Rucha Mehta first. So Dr. Mehta, can you please highlight on this? What is the impact of this increasing obesity in our population? Is there any other parallel epidemic like this diabetes, this fatty liver, obstructive sleep apnea, polycystic ovarian disease, ischemic heart disease, dyslipidemia? These are also parallelly chronic kidney disease. Do you think that these are the parallel to this number of this increase in the number of the diabetic persons or the number of the obese or overweight persons in our country? Can you please highlight on this, Dr.
Sure.
Mehta, please?
Thanks, Dr. Ghosh. Yes, and thank you for a beautiful explanation. That in fact it's very really fulfilling to think that now we have the paradigm has arrived जब हम सिर्फ डायबिटीज को ट्रीट नहीं करने वाले हैं बट फर्स्ट ऑफ जो पहले से सुनते आ रहे दैट वी शुड अडॉप्ट लाइफस्टाइल चेंजेस because obesity and overweight is the crux of the matter. And it's not just diabetes, as you pointed out, because when we start putting on weight or more importantly, fat, There are many other things that can happen. And some of the more common ones are having a high cholesterol, having high blood pressure, and of course, uski wajah se high incidence of heart disease, which is either could be a heart attack, heart failure, coronary artery disease, or having a stroke, which is paralysis, so having some blood vessel disease like that. Secondly, of course, we get fatty liver, which has become now a very important condition to keep in mind. So this fat can accumulate in many parts of your body and in all the organs. It can creep in into all these organs. So एक तो liver है, एक तो आपका heart है, फिर pancreas के अंदर जहाँ से insulin बनता है वहाँ पे भी fat accumulate होता है. Similarly, young girls, we say that they have this disease called polycystic ovarian syndrome, which is that they are unable to have normal periods, and in the long run, they might not be able to have children. So they can have infertility, is also linked to obesity. Now, many other things, of course, obesity can affect you from top to bottom, but it has also been linked with increasing chance of having dementia or memory problems, increasing chance of having a condition known as sleep apnea. So if you just go from top to bottom, it affects your lungs, it has affected your brain, it can affect your heart, as I already mentioned. Lastly, it can cause many different kinds of cancers. And also, of course, by virtue of being overweight, we are seeing so many knee replacements. So the orthopedic surgeons are maybe very happy, but hip joint problems, orthopedic joint problems are very common in also patients who are overweight and obese. So I think these are some of the common things that we see on a daily basis. And we need to keep in mind that maybe we need to have a shift in paradigm change. And how much weight loss, whom do we advise? As Dr. Ghosh pointed out, that Indians at a lower weight start getting all these diseases. So I think lots of important things that we have to keep in mind. So thanks, Dr. Ghosh, for that important question. Yes.
So we can come to Dr. Nitin Kapoor. So Dr. Kapoor, do you think that is there any genetic basis for this increase in obesity and related disorders, particularly in India, when we can see that this body weight of the standard condition at par with the global situation, number of the diabetic persons are actually double in India. So is there any genetic basis, Dr. Kapoor, please?
Thank you, Professor Ghosh, for that question. And I think we always have this debate whether obesity happens because nobody runs in the family or whether obesity runs in the family. And I think the answer is both are equally important. Now, when we're talking of whether it is running in the family or is it genetic, and जब हम देखते हैं कि सबसे ज़्यादा साइंटिफिक एविडेंस कहाँ से आता है, ये ट्विन स्टडी से आता है, जिसमें जुड़ा जो बच्चे होते हैं उनमें जो जेनेटिक सिमिलैरिटी होती है उसके माध्यम से जब हमें पता लगता है तो वी रियलाइज दैट obesity is one of the most inheritable human trait. So today we can attribute about 75% of similarity of BMI to the genetic basis. So definitely it's very, very important. It's even more important in people who have morbid obesity or very severe forms of obesity. उसमें genetics का ज़्यादा role है, and even in people in India, and specifically talking of the Indian setting, जहाँ पे अभी भी consanguinity, मतलब आपसी रिश्तेदारों में शादी जब ज्यादा होती है तो उसमें ये genetic problems बढ़ जाती हैं. We recently did a study here in Bangalore जिसमें हम देख रहे थे कि कम उम्र में जब ज्यादा ओबेसिटी हो जाती है तो कितने लोगों में जेनेटिक प्रॉब्लम होती है, एंड वी फाउंड कि 5 में से एक को एक जेनेटिक रीजन मिल जाता है जिसमें ओबेसिटी होती है. दिस इज वेरी वेरी इंपॉर्टेंट बिकॉज आज की डेट में नई दवाइयां आ रही हैं जो स्पेसिफिकली इन जीन्स को भी टारगेट कर सकती है. बट talking about the garden variety obesity that we see in clinical practice, genetics is important and environment is also important. Genetics predisposes you to get obesity, and if you have an obesogenic environment, you would likely to get more severe forms of obesity. So yes, that is very important. And I think taking this discussion further, I think a wonderful initiative by RSSDI, and thank you for having me on board. And if I may ask Dr. Neeta a more important question, like many times in clinical practice patients आते हैं पूछते हैं कि हमारे घर में गांव में तो सब लोग बहुत घी खाते थे एंड बहुत ज्यादा तेल की चीजें यूज होती थी, तो घी खाने से तो कहते हैं सेहत अच्छी बनती है एंड लाइफ इज आल्सो लॉन्गर. सो how would you respond to such a question, Dr. Neeta? Is it really true in today's world that eating these copious amounts of ghee and other kinds of foods which were eaten by our ancestors and probably at that time was good for them, but how do we answer this in today's world?
Yeah, that's a very good practical question that you have asked, Nitin. There are a lot of patients who come to us and say कि हमारे दादा परदादा सब इतना इतना घी खाते थे, मक्खन खाते थे, उनको कुछ नहीं होता था, and ये सेहत के लिए अच्छा है, and we don't believe all this new kind of research that has come in. मेरी उनसे एक ही मैं एक ही जवाब होता है कि आपके दादा परदादा इतने एक्टिव हुआ करते थे, खेतों में काम करते थे, चलते थे, उनके पास गाड़ियाँ नहीं थी। तो they used to burn off all those calories. That is number one. And secondly, when we say that something is good for health, like even ghee, the quantity matters. Today, in an obesogenic environment, we eat too much of even the good things. So, too much of anything is going to increase obesity and is going to be bad for the metabolism. इसलिए आप क्या खाते हो ये डेफिनेटली महत्वपूर्ण है, लेकिन कितना खाते हैं ये भी महत्वपूर्ण है, और उससे ज़्यादा इम्पोर्टेंट है कि आप कितने एक्टिव हो, कितना बर्न करते हो। और जो भी रिसर्च आज के ज़माने में आता है, वो ऐसे सब्जेक्ट्स के ऊपर होता है जिनकी एक्टिविटी लेवल बहुत कम होती है हमारे दादा परदादाओं से। सो एक्टिविटी लेवल के हिसाब से देखा जाए तो कोई भी चीज़ जब हम बोलते हैं कि अच्छी है सेहत के लिए, उसके साथ में जुड़ा हुआ उसके लिए कितना आप खा सकते हो, ये बहुत ज़रूरी है, महत्वपूर्ण है। और दूसरी बात ये है कि you keep getting information from all kinds of sources which may not be authentic. It may be Google, it may be internet, it may be social media influencers or anything of that kind, but please make sure that it is backed by the right evidence. आज के तारीख में इंडिया में भी बहुत सारा रिसर्च हो रहा है कि what is good for you, what kind of oil is good for you, whether ghee is good for you or bad for you. Let me put it this way. I will not say that ghee is bad for you, but it is very important to note that the right quantity is very very important. It has to be as little as possible. बहुत सारे restrictions है कि कितना percentage होना चाहिए पूरे दिन के कैलोरीज में, उसका क्या हिस्सा होना चाहिए। सो ये सब एक न्यूट्रिशनिस्ट या ओबेसिटी फिजिशियन, जिसे हम बेरियाट्रिक फिजिशियन कहते हैं, उनकी सलाह लेके ये सब फॉर्मुलेट हो जाना चाहिए। सो दैट इज़ द इम्पॉर्टेंट पार्ट। मैं वापस आऊँगी डॉक्टर सौमित्र घोष के पास कि एक बहुत इंटरेस्टिंग सवाल उठता है कि 50 साल पहले क्या हम लोगों का वजन, was our weight, what was our weight 50 years ago and what are the average weights in today's date? It would be very interesting to know how we have evolved, from what level and what level we are at now. That is the important thing. So Dr. Soumitra, can you tell us about that?
A very interesting question, Dr. Neeta. Thank you for asking me such a beautiful question, because it is a major concern across the globe, because this average body weight of every person across the globe is increasing over these last 40 years or 50 years. It has increased significantly, and we can see almost per decade, per every 10 years, the average BMI of every person is increasing by 0.32. So it is a major concern, because what was 22.1 across the globe in 1975 has almost become in 24.4. So there is a change of 2.3. I mean, I mean the standard BMI in the female persons across the globe, and in males it is 21.7. It was in 1975, and it has become 24.2 in males across the globe. And this India is also not far behind. You can see that these Indians or the Asian countries used to have lot many malnutritions, and this average nutrition was actually less compared to this global situation. And still, when this average comes, then we can see that there is a major shift from this malnourishment area to this overweight. That is another form of malnourishment. Whether it is underweight or overweight, that does not matter. It is a malnourishment state, be it in the underweight or overweight. This mean BMI in Asian countries, including India, which was in 1975 15.8, only 15.8 for the girls, had increased to 16.9, and for boys 15 to 17.9. So there has been a major change in the Asian countries, including India. And if these trends goes on across the globe, then in 2025 we can see that the obesity increase will to more than 18% in the males and 21% in the females, and severe obesity also will increase. So BMI more than 35, that is also significant increase in males to 2.3% to 5% in the females across the globe. So just it has to be considered that it is not the problem with the individual, that single individual. Sometimes people blame that they can eat more and that is the reason they are becoming obese or their body weight is increasing because he eats more. Because that is the basic concept, that is actually a wrong concept. It is not because of this more eating, but it is a part of it. So actually with this global situation and this standard Indian situation, I will come to Dr. Nitin Kapoor. So Dr. Kapoor, can you highlight what may be the possible reasons or the causes behind these major changes in the body weight? People are becoming overweight or becoming obese in the last few decades. What you can see, is it the changes in the lifestyle, food habit, or something else? So please highlight, Dr. Kapoor.
Thank you, Professor Ghosh. And as you rightly mentioned, that the pandemic is just increasing of obesity. And I think if we were to just pinpoint a few important causes why this is increasing, I think the first and most important thing is easy availability of very calorie dense food. Today, if I go to the market and if I want to get, say, something, if I'm hungry and if I want to buy something healthy, maybe a few apples, as compared to a burger from any of these fast food chains. I might get a burger with fries with Coke for, maybe less than 100 rupees, but I may not get that much, quantity of apples to fill my appetite with the same amount of money. So today we can get very easily double-sized calorie-dense foods very, very easily at the tip of our mobile with all these food apps which are coming up. But the healthy items, unfortunately, the protein rich food items, the fiber rich food items tend to be much, much more expensive. So I think that is one reason, and health policy needs to change to make sure that the right kinds of food are available to the common man so that their health is improved. Well, that's not the only reason. We also talk about limited physical activity. Dr. Neeta pointed out while talking about her point about how our forefathers used to probably even walk several kilometers to fetch a small pint of water, pitch of water. But then today, while sitting at a particular, room, we can, with our mobile or a remote, switch on our fan, AC, TV, everything, just at the mobile tip. And with so many apps available, I think so our physical activity is also very limited. So it's not only the diet, it's also the physical activity. But the important point that I'd like to highlight for all the viewers who are listening to us and are struggling with obesity, I think it's very, very important that you need to consult the right kind of a person, a specialist, a doctor, a medical person, to understand the reason why there is obesity for you. Because for each patient, there may be a different cause. It's just not that one size fits all. It's just not that if we eat less and walk more, and that's going to work for everyone. We need to find out the right causes and address them. And for that, you need to see the specialist. But yes, overall, the pandemic of obesity is just exploding. And is it really exploding equally amongst men and women? Today we talk of gender equality. I'm very happy to see that in this panel we are 2:2 and 1:1, exactly equal. But if I may ask Dr. Neeta, how the impact of obesity is different across genders? Is it similar or is it different?
That's a good point, Nitin, and it is very important to understand that obesity affects males and females unequally in a sense. And that is because inherently, biologically, women have a lower metabolic rate, that is, they expend less energy for the same calories. And the other point is that at different time points in a woman's life, she is more prone to putting on weight. Like, for example, at menopause. At menopause, women typically put on 4 to 5 kgs of weight, mostly fat, and mostly around the abdomen and the viscera. So इसका मतलब है कि महिलाएं ज़्यादा शिकार होती हैं मोटापन की, and that is the reason that they have to keep their goals also differently. They have to be treated a little differently. So gender inequality is there in the risk for obesity at different time points. Of course, अभी बात की थी ओबिजोजेनिक एनवायरनमेंट की डॉक्टर नितिन ने, जैसे कि बहुत सारी चीज़ें मिलती हैं खाने के लिए जो अनहेल्दी होती है, तो मे बी दिस गैप इज क्लोजिंग बिटवीन men and women because they are equally susceptible, equally exposed to this kind of an obesogenic environment. But strictly scientifically देखा जाए तो महिलाएं ओबेसिटी के से शिकार ज़्यादा होती है, and that is an important point to remember over here. So that brings me to the one of the last points which I would like to ask Rucha. Rucha, we know that obesity is increasing. What do you think are the social determinants, or what are the social implications of such a rise in obesity in our country today?
Yeah, so I think that's great, and I think social determinants Dr. Nitin has sort of covered is, the fact that what we call epigenetics. Genetics is something we are born with, and social is everything around us. So हमारे आजू बाजू सब जगह in India, if there is a childbirth, we love to eat food. We celebrate everything with food. And when I moved here from the US, I realized I had to treat my patients for 6 to 7 meals a day. In Gujarat, where I live, we have a not only breakfast, lunch, and dinner. Post lunch, we have two breakfasts. One when you get up in the morning and a proper breakfast. Then we have a lunch and we have a proper high tea, and we have a dinner. Then we go out with friends for a post dinner. Just for a jaunt to have some ice cream or something, etc. like that. So I think that is a huge thing we can do when we start thinking about how to treat our patients. So as you said, calories have to be reduced, but the number of meals can be reduced is definitely something important. Number two is that when we start treating our patients, all of this becomes very important. Okay, घर में कहाँ से घी आ रहा है, कहाँ से तेल आ रहा है, what kind of cooking is being done, what kind of healthier meals can be prepared. So it doesn't have to be a crash diet or a fat diet, but certainly a structured approach is very important. Because as Dr. Neeta asked me, the social stigma has become very high. Everybody is now into Hollywood and Bollywood, and everyone wants to look good. We are in the world of when my patients actually ask me कि उनको सिक्स पैक बनाना है मैडम तो कितना परसेंट बॉडी फैट करना पड़ेगा. So I have to be ready with those answers के सिक्स पैक बनाने के लिए फिर मुझे then after 15-20 मिनट के बाद I ask them कि सिक्स पैक क्यों बनाना है, like what is your target. Um, and is it just to look good, but let's now focus on, let's do some tests and see if you have any medical conditions. क्योंकि फैमिली में सबको डायबिटीज था, फैमिली में सबको हार्ट प्रॉब्लम था, तो आपको हो सकता है. So let's focus on that for a second. So that's I think what becomes more important. The good news
Yeah.
is that we also have lots of options and treatments. As I said, I'm very happy we are having this program which tells us that we are recognizing obesity and overweight as a problem before they become major metabolic problems. So we want to treat at the grassroots level. So truly the answer is of course lifestyle change, lifestyle change, lifestyle change. As Dr. Nitin said, nobody, it runs in the family. So my first sentence to my patients is you cannot change your parents. So you will have to change yourself. So we definitely have to do that. Okay, let's make these changes. So lifestyle of course begins with dietary changes and hand in hand with exercise management. But I believe we also have some medical options available nowadays and some surgical options. So can I ask Dr. Ghosh maybe if he wants to just briefly tell our audience? Dr. Purvi has given me some permission that we can extend for another 5 to 10 minutes. So Dr. Ghosh, the audience has also asked about intermittent fasting, and maybe we can ask Dr. Neeta about that later. Dr. Ghosh, can you enlighten our audience that it's not the end of the world? There is some light and some hope for all of us.
Definitely, as we can see that this obesity is increasing not only in India, it is across the globe, and it is not only this in the last few years only. It is over the decades. This change is coming, and it is major concern. And in every family, we can see this impact of this major increase in the body weight. We can see number of the people having diabetes, number of the people are having hypertension, fatty liver, polycystic ovary disease, ischemic heart disease, and many other conditions. And all these conditions are actually the result of these increased body weight or the body fat increase in the body. So what we can see that if we can treat all these situations alag alag say, then it is a big burden, and so we should be very careful about keeping our body weight within the limit set by the physicians. So we'll have to be very much aware, and we must be very careful about keeping our body weight within the limit to keep all these non-communicable diseases under control. So as we are aware that this blood sugar should be treated, hypertension should be treated, ischemic heart disease should be treated, and as like those things, we should treat our obesity. We should be careful about our body weight, and we should be taking the help of the physicians, those who are dealing with this. So just don't be just ashamed that your body weight is increasing. Take the professional help, take appropriate measures in your daily lifestyle so that the body weight is under control, to prevent these further metabolic changes in the body or other diseases coming out of this increased body weight, so that these your life years are increased and your quality of life is also increased. So I will request Dr. Neeta Deshpande and Dr. Nitin Kapoor as well to give their last few comments for all our viewers, those who are watching this program. Dr. Deshpande, please. Dr. Deshpande, you are.
Yeah, yeah, I will summarize at the end. So I would request Nitin to give his last remarks, because I think Rucha has given her remarks and so has Dr. Ghosh. So after Nitin has given his remarks, I shall summarize.
Great. So I think it was a great discussion, and we need to have more such, social interactions to increase the awareness of obesity. And the only message that I'll leave you with is that if you are struggling with obesity, don't go through anything and everything that's available on the internet and on your hand. Go to the specialist, get treated properly. You will definitely benefit. Over to you, Dr. Neeta.
Yeah, thanks, Nitin. So we've had a wonderful discussion, and I hope our audience has benefited from this. This is just the beginning, it's just an eye opener. There's lots more to come. And I would like to summarize by saying that obesity is on the rise in India. It is giving rise to a lot of other diseases. In fact, obesity is the mother of all diseases. So, diabetes, hypertension, heart disease, and the lesser known consequences such as cancer also being related to obesity. Not to forget the mechanical complications of obesity, such as knee problems, spine problems, gallstone problems, snoring, obstructive sleep apnea, etc. So, you can see now from what I have said that obesity is not simply looking fat, it is a medical disease. It should be recognized as a disease, and when there is a disease, you go to a doctor. And that is why treatment of obesity is teamwork. People have to understand that it is teamwork and it has to be seen by two or three different specialists and a qualified nutritionist. So, my request or appeal to the audience is treat obesity as a metabolic problem, a non communicable disease, seek the right kind of help. To this end, from our side, we are promising a few things. The RSSDI Obesity Task Force, of which we four and two other doctors, Dr. Venkat and Dr. Naval Vikram, who are not here today, they are also members. And we at the task force have lined up a lot of awareness programs, and we will connect with the people of India to talk about obesity and to dispel all the myths that are surrounding obesity and try to make India obesity free. I know it's a very tough task, it's very uphill, but we have to begin somewhere. So, through the RSSDI Obesity Task Force, we will have a series of programs that will go on for quite a long time. And with this, we hope to bring scientific knowledge to the public at large to understand what obesity is, because today it is an epidemic. So at this point, I would like to end over here. I would like to hand it back to Purvi Chawla, who has worked very hard to put this particular program together. Thank you very much, Purvi, and I hand it back to you.
I can just say that I'm really overwhelmed because we had planned a series of 3 sessions where we would, talk about different aspects related to diabetes. But today's session has clearly been a very, very interesting discussion and wonderful points brought out by each of you. Truly, they are the niche experts that we have in our country today, and really hats off to them. And a big thank you from on behalf of our RSSDI National President Dr. Vasant Kumar sir, our National Secretary Dr. Sanjay Agarwal sir, and the entire executive committee as well as the social media team. Big thank you to Professor Dr. Soumitra Ghosh, sir, and Dr. Neeta Deshpande, Dr. Nitin Kapoor, Dr. Rucha Mehta. Thank you very much for being here. And I'm really looking forward to all the other initiatives being rolled out. Because I think this is the need of the hour, and very pertinently enough, our task force has stood up to the challenge, and we will assist you in every way that you need us to. So thank you very much for this really important and very enlightening discussion, because it's high time that not only physicians but patients also look at obesity as a disease and not just a cosmetic problem. Thank you so much.
Great. Thank you so much.